This has got to define everything that you do, your values and your vision. You cannot create value for your patient unless you stand, as a group unless you as a group stand for something. By the way, this could also be called your identity, because once you define your vision and your values, that will be how you become known in the marketplace. And if you don't define that, guess what? Your patients will define that for you. There's no such thing as right and wrong. There's no such thing as good and bad. You know what? There's only results, and those results are only defined within the values and the vision that you all have laid out. There is no good or bad. There is no right or wrong. There's no judgment call here. There's no personal judgment. Look, it either supports the results, in which case we keep doing it, or it doesn't support the results, in which case we change the approach. There's nothing good, there's nothing bad, there's nothing right, there's nothing wrong. There's only the results that are defined within what you've laid out as your vision. Everybody on the team is a leader. This is very, very important. To begin to have cohesion, to begin to create value, you've got to create value within the organization itself. But when I got out of school, in the School of Business at MTSU, I have a business degree, I have a BBA. You could get pretty much a business degree. Now you can get MBAs in everything from hospital management to something called organizational behavior. And this is what everything that we're talking about right now is organizational behavior, is exactly what it is. It's gotten to the point where companies now realize what we've been saying for the last 14 years. Not that we were the only ones saying it, any stretch of the imagination. Management has principles, and they're the same regardless, okay? Maybe the orchestration is different, maybe the layout is different, but it's all the same in terms of the principles that are going to have you be successful. Organizational behavior, you know what the prediction is? Does anybody get the Wall Street Journal? Nobody here gets the Wall Street Journal? There was a prediction just a few months ago in the Journal that in the future, in the very near future, within the next 15 years, in addition to corporations having a chief executive officer, a CEO, and a chief financial officer, a CFO, they're going to have a chief organizational behavioral officer, a COB. Because this is so important, and corporations realize it now. They didn't realize that 15 years ago, 20 years ago. Everybody on the team has got to be a leader. How do they become a leader? Doctor, you give them the authority over an area. And then guess what? You hold them accountable for the responsibility over that area. They have to have both, and you can't have one without the other. You can't get the authority without the responsibility. But you can't have responsibility over something if you don't have the authority. So you have to give both. And doctors, get up. Staff members, you got to take it. We spend a ridiculous amount of time on this one conversation. We have clients we've been with for 12 years. We still have this conversation. And everything we do is around this management concept. No one person can be an island. No one person. So we divide the practice into areas, which we'll talk about specifically as it relates to value here in just a minute. Everybody on the team is empowered to make decisions. Everybody on the team is expected to take risks. That means if I'm an assistant and the area that I'm responsible for is the whole operative department, then what that means is my doctor is giving me the authority to make decisions and holding me accountable for the responsibility of making those decisions. And it's understood. There's no good, there's no bad, there's no right, there's no wrong, there's only the results.